afternoon. Assalamu alaikum to all. As I have opted to deliberate the topic, because as Dr. Ghalib has told already, WHO this year on 17 September, every 17 September it is declared as Global Patient Safety Day. And now this time the WHO came out with the theme, medication without harm. And I thought pharmacovigilance is the one which is going to do direct relationship with absolute ensuring the safety of the patient who are using as the end users of the drug, and more for emphasizing about the medication without harm. In continuation of this is my supposed to be the second talk where I have correlated I took this topic, abuse and misuse of medicine, particularly it is with reference to Unani and the role of pharmacovigilance. The objective, the thing what we are going to cover, outline of this presentation is we'll try to understand some of the terms like very often we use medicine, abuse, misuse, and pharmacovigilance. And the second objective of this presentation is to understanding the factors which are associated with abuse, misuse of medicine, particularly Unani, what probably it is up to my understanding. I would like to share with all of you, the August audience. And the final is to create awareness among the stakeholders of Unani medicine, where it encompasses all the practitioners, teachers, students, and the people who are working for the healthcare delivery, particularly to focus about the awareness on preventing abuse and misuse of medicine and reporting such ADRs associated with the misuse and abuse of drug. Finally, a small conclusion where we would be likely to talk about what exactly these things or how it can be regulated. As all of you know that the term medicine is of course very often known, everybody knows about this. Medicine is something like this word medicine is derived from the medicinia, that is a Latin term which arises from the word mediri, which means to heal. In fact, medicine starts for heal, but at the same time people also say physician who is a practitioner also. But moreover, medicine is also defined as the science practice of diagnosis, treatment, and prevention of disease other than surgery is also called as medicine. For all of you, we know that whenever the term medicine used, this also stands for the drugs. Basically, we are going to talk about more the drug, the use of the drug, and the drugs, not only the drugs, single drugs, the other preparations, particularly meant for either the treatment or prevention of disease or sometimes for the diagnosis of the disease also. And now this drug is a term derived from the French language. There's a drogue, which stand for any substance. Today, the conventionally people called as this is any chemical. Substance is previously, when it is in the beginning, this word was stand for all the herbal powder which is available in the form of a powder was dry. So they called it as the drogue, which stand for the dry substance chemicals. And you know, whenever we as a physician prescribe the drug, there are certain terms involved that the use of medicine involves, like use as prescribed. Generally, as a physician, assume that as a physician, as a teacher, as a practitioner, when we prescribe medicine, the prescribed use as a prescribed will recommend the patient use as prescribed the medicine, because physician is the authority who mentioned who prescribed the drug with appropriate dose to be taken and the dosage form. What exactly? Suppose if you look at that, there are different drugs available in different dosage form, like a oral and topical applications also, and how frequently to be uses. And if it is prescribed one, generally the 90% of the people who use medicine which are after the prescription given by the physician. As if, like, look at this, I have one picture is a marjune chopchini, is one of the drug that can be given for different indications that I'll show in the next subsequent. This is prescribed one. Here, the physician will give you what is the dose to be taken, and the dosage form is it's a margin, and how frequently it should be given when the doctor prescribed. In contrast to this, there is another condition, use as appropriate. It means that there are no specific direction for frequency and quantity of use. For example, a person who is suffering with insomnia, sahar, agar bekhwabi ka masla ho, what happened? They started taking some of the hypnotics, some sort of sleeping pills. Sometime what happened, as a habit or as prescribed by the doctor, they start using this pill. But even though the pill which in the quantity prescribed by the physician is not enough sufficient to bring sleep, to induce sleep. So at that time, what happened? Most of the patient, not only in the sleep cases, for some of the conditions, they take another dose with a sufficient gap to obtain the purpose, the purpose of the medication. I mean, here we have a space and taken second dose of the medication so that the person can get the benefit of the drug. Likewise, this is appropriate. The dosage, control, and duration should be there. This is another aspect of use of medicine. Another, the most important aspect is most of our drugs are sometimes the drugs which are available as over-the-counter drugs. Even nowadays, some of the Unani drugs are also available, are being sold over the counter. So in such a case, people by passion, they'll carry the drugs where it connotes there is direction with reference to use and frequency. If you look at this slide, I hope that you can able to see, this is also the Majuni Chokchini. If you look at that, here there is a indication, and this is used for Farley, Vajamafasil, and etc. etc. Here it is mentioned about that how frequently, what is the dose to be taken, 5 to 10 grams, or otherwise as directed by the physician. If physician prescribed, that the things will be very clear. Sometimes if it is not prescribed by the physician, then one can able to use as directed here in the prescription. So my concern is, the purpose of bringing this is, medicines are nothing but the drugs which is being used for certain indication, either by the prescribed pattern or sometimes the prescribed drug with appropriate enhancing in the dose or as directed by the prescription. So these are the different uses of the medicine. Let me take you to the another aspect, as because we're talking about medicine abuse and misuse, and finally to the pharmacovigilance. Abuse of medicine, then we call it as abuse of medicine. Basically, abuse refers to improper use of something. अगर हम अब्यूज को लिटरली समझने की कोशिश करेंगे तो इससे माखूज लफ्ज इसकी जो माने ऐसी हैं कि improper use of something or anything. As we are talking about the abuse, improper use of medicine, लिहाजा abuse of medicine को अगर हम इस तरह define कर सकते हैं, referred as excessive, mean taking more than the prescribed drug, maladaptive, not appropriate. Sometimes it leads to addictive, have dependency of the drug, that is use of prescribed only. Sometimes the doctor prescribed the drug, but they are using excessive or inappropriately. That can lead to dependency. Sometimes it could be prescribed or over-the-counter medicines that is being meant for certain use only. जैसे कि माजू ने चोपचीनी को अजमाफासिल फालिज के लिए इस्तेमाल किया जा रहा था, okay, but abusing stand for when the person started using excessive, maladaptive, addictive drug. और इसको मजीद समझने के लिए हम कब कहते हैं abuse of medicine? As I said, excessive mean obviously it is a overdose. इसका मतलब ये हुआ जितनी क्वांटिटी में उसको प्रिस्क्राइब किया गया था लेना चाहिए, उससे कुछ ज्यादा ही ले रहे हैं. What is the end effect of this? If a person taking the drug which is more than the required prescribed quantity, sometimes it can lead to nearly fatal dose, that it can cause death of the individual also. Or at least, if it is not going to have a death, it might be causing impairing organ function. किसी ना किसी अज़ू पर इसके असरात वाज़े कर देता है और उस अज़ू के अफ़ाल को खत्म कर देता है, अब बातिल कर देता है. That is excessive dosage. So one should be very careful. एक और बात हम समझने की बात कोशिश कर रहे थे, that as is a maladaptive, it means it is not appropriate, not adjustable, inappropriate behavior. Something like हमें लगा कि कोई दवाई ले रहे हैं उसका असर नहीं कर रहा है, तो then again started taking and the drug is not doing appropriately. The third important thing is sometimes what happens, no, abuse of medicine can lead to addictive, mean आदत बन जाना, habit बन जाना. इसके दो पहलू हैं. Sometimes what happens, no, if a person regularly using either a prescribed drug or over the counter drug, if you started using regularly, there will be chances of physical dependency. ऐसा लगता है कि जब तक दवाई नहीं ली जाएंगे, we are not talking about any narcotic drugs, मंशियात से मुताल्लुक नहीं, बल्कि आम रोजमर्रा की जो दवाइयां किसी भी मर्ज के लिए की जाती हैं, लंबी मुद्दत तक इस्तेमाल करने पे इस तरह के असरात मुरत्तब होते हैं. अगर कोई बंदा रेगुलर दवा इस्तेमाल करता है तो there is chances, not all the patient will complain, some people will be complain of physical dependency, man, it can cause habitual. If they take medication, then only they feel very happy, otherwise there will be some sort of a problems will be there. Sometimes the patients are started craving, एक तरह का ख्वाहिश होती है, एक तरह की लत की तरह हो जाती है. This leads to psychological dependency. You know that dependency is purely a kind of a mental kind of a psychological problem. So all abuses are one and another way, it causes fatality or otherwise impairing the organ function. Sometimes it causes non-adjustable physiological phenomena in the body, or it might be causing physical dependency, habit formation, or psychological dependency also. This is about abuse of medicine. ये general बात है, किसी भी दवा से हो सकता है. Let us try to understand what is this misuse of medicine. Misuse of medicine involves something which is not following the instructions. Somebody is not following the instruction as prescribed with the physician. Like what exactly it could be? The first primary point what we have understood is taking a dose of medicine. दवा को इतनी मकदार में ली जा रही है, that is not correct. Incorrectly taking the dose of medicine or wrongly taking the medicine. And now this has become very common among the Ayush practitioners, particularly what I felt from Unani point of view also. The dose of the medicine is most of the time the patients will take incorrectly or wrongly. We'll try to understand what exactly incorrectly. If this incorrect wrong dose could be too little, but हम कहते हैं कि तुम्हें इस तरह 2 तोला इसको दवा को इस्तेमाल करना है और 10 ग्राम लेनी है, सुबह शाम लेनी है. So then people sometimes they ignore or they may not be properly aware to take that. They started taking suboptimal quantity, low, too little dose. Too little in the sense low dose. In such a case, it cannot be give any effectiveness. This leads to ineffectiveness. According to the pharmacovigilance, any drug which is low effective or something is not causing effectiveness also comes under the purview of pharmacovigilance. This is incorrect one. Second understanding of these incorrect wrong drugs are sometimes what happened to taking too high doses. Like as already told, there is called as excessive. As I said, too high dose can lead to toxicity, organ effect will be there. Intoxication, it could be a dangerous and it leads to fatal also. More often we come across this, sometimes the patient, they have taken the dosage which is beyond the body threshold level. Ultimately they will they met with the fate of something like very irrecoverable damages. Another aspect of incorrectly or wrong kind of a dosage of the drug, what we understood is too often, like sometimes the patient started taking that too oftenly. There is a psychological dependency. If you try to withdraw that, if you try to ask them to stop taking, the patient started complaining of withdrawal symptoms. Of course, तिब्बी यूनानी में बहुत सारी दवाओं का इस तरह का reported नहीं है, but we are expecting the people like you to document about that. अगर किसी मरीज ने किसी दवा के मुनक़ते करने पे, इस्तेमाल करने से रोकने पे अगर इस तरह की कोई चीजें हो तो आप you please report it. I believe that there are some drugs in the pharmacopoeias of Unani. They do have certain effect, like if you stop taking, it causes withdrawal symptoms. And another aspect of taking dose of the medicine wrong time. For example, some medications are specifically asked to take before meal or after the meal. Some medicines are not recommended to take in conjunction with some other drugs. Some medications should not be taken appropriately. So time is also very important. If the patient or the end user of the drug, they are not adhere to the time based upon the diurnal variation and the patient condition, it may also leads to, it also comes under the category of misuse of drug and may cause pharmacovigilance part of the. Forgetting to take a dose is also misuse of the drug. This forgetfulness, we don't know the reason of the forgetfulness, may be busy or sometimes the drugs may not be available or whatever the fact, any ignorance or skipping the taking the dose is also comes under the misuse of drug. Sometimes what happens, the drugs are being used for wrong purpose. For example, in conventional medicine, we have hundreds of drugs are there. They have been used like narcotics for different purpose. But from Unani also, some of the, like recently we came out of that one pharmacovigilance point of view. In New Zealand, people started using this opium kind of the drugs are not available as a substitute. Barshasha is being used to induce opioid-like effect. So the wrong use of medicine. Barshasha is indicated for certain conditions according to Unani description, but people started using with the dependency like any drug which is not being indicated or the indications are not being available. If started using such a drugs also considered to be called as misuse of medicine. And the important point is early stoppage of medicine. Nowadays, we often come across the diabetic patients. They said that I am not taking the medication because my sugar levels are controlled, or somebody has told that your sugar levels are under good control. It doesn't mean that the sugar levels are controlled. The control is just because of taking some medication. So not only the diabetes, there are so many cases where the patient assumed that their conditions are covered, recovered, or controlled. So they stop taking the medication. So my dear friends, the misuse under the purview of misuse of definition, taking a dose of medicine either incorrectly or wrong time, forgetting to take a dose, taking medicine for wrong purpose, even early stoppage of medicines also comes under the misuse of medicines. Okay. Let us try to understand these two terms, abuse and misuse. Basically, when we talk about this abuse and misuse, often people say these are the interchangeable terms, but they are not interchangeable. It is the individual intention will decide about that, whether it is abuse or misuse. As a patient who will explain about that, what is the intention behind taking some of the drug, whether it is because of habituated abuse or misusing for some other purpose. And now, this medicine abuse and misuse, both conditions are often associated with prescription drugs. My concern is this is not only the patient are likely to go and get the medication from the counter, but when the physician prescribed the drug, they started using the prescription for months together without taking second opinion or without consulting the doctor. So one should be aware of that, what drug should be taken and how long it should be taken. And here, and this misuse and abuse, all people of all ages are affected by prescription drugs that either misuse and abuse. It's not only small children and the elder people. Most often it is seen among the geriatric population also. It doesn't mean only the geriatric, and the all age group people have been affected with the use and misuse of prescription drugs. And the point of concern here, it is this abuse and misuse of medicine can lead to adverse event or adverse drug reaction. Often we have observed that this is the genesis of pharmacovigilance and objective of the pharmacovigilance, because any drug-related activity is been reported with any drug which comes under the part of the pharmacovigilance. Let me take you to the WHO's definition of pharmacovigilance. Ultimately, we are working for this, and our aim is to make the society free from adversaries. Pharmacovigilance, according to WHO, is defined as a science and activities relating to detection, assessment, understanding, and prevention of adverse effect or any other possible drug-related problem. If you are using any medicine, anything which is not expected, that can be reported also. Under this pharmacovigilance, the scope, the sphere has also been expanded to, because here we are talking about the possible drug-related problem. Under the purview of the drug, WHO and the global health authorities, they included drugs which is derived from herbs, traditional and complementary alternative medicines, blood products, biological, medical devices, vaccine, substandard medicines, medication errors. Likewise, there are so many things included. It includes abuse and misuse of medicine also being covered under the definition of pharmacovigilance. That is the reason I have elected to discuss this topic with all of you people. Let us try to understand ultimately what drug-related activities be reported whenever we give drug to the patient with certain intention. Sometimes what happened, the unintended effect, noxious effects will be appear. That noxious effects are defined as adverse drug reactions or adverse drug event. Let me explain you. This adverse drug reactions are what is called as abbreviated as ADR, which is defined as any noxious, means something like a very noxious and harmful, unintended. We never expected such an effect resulting from the use of an authorized medicinal product. There are so many medicines which are authorized, marketing available in the market, are prescribing with the physician for a long time. But even though sometimes what happened, exceptionally, some people started complaining of unintended effect. And that too, these unintended effects are happening just with the normal doses that is prescribed according to the pharmacopoeia or the observation of the physician. Above all, sometimes what happened, these noxious and unintended effects will be occurring due to abnormal use or misuse of the drugs also. So adverse drug reaction are noxious unintended effects with use of authorized medicinal product. Either it could be a normal dose, abuse, or misuses. And now, as I promised, the second objective of my studies, there are factors which are associated with the abuse, misuse of Unani medicine. This is my understanding. I am not going to claim that. If you have, you can recommend me, you can suggest to me, probably I can incorporate it, what I understood. What are the factors which are responsible for abuse, misuse of medicine while treating with the Unani people is, there is a belief in the system as effective. Most of the patient, and the patient will come to the Unani practitioner, healthcare provider, they believe that, yeah, this is a very safe and effective medicine. Anecdotal, we are learning since a long time. My grandmothers, from there they have started using the drug and they are effective. That is the reason we will use. One aspect. Second aspect of the thing is abuse resist. And this Unani medicine are the drugs which are derived from nature, mean from the fitrat. And according to the people's understanding, the thing which is derived from the nature are safe, mean they don't carry any noxious effect. Now it is being proved that even the product which is being derived from the nature are also not safe. It is only the dose and the dosage will decide about the effectiveness of the substances. Third important point is with reference to Unani. If you look at that, we have a very wonderful concept, dawai, ghizai, dawai. There are drugs which are ghiza also. Food, medicine, and medicine, food. Dawa, drug, and ghiza. Likewise, there are certain ghizas which are also work like a dawai. And the conventional medicine people also called as a nutraceuticals, means the nutritional substances which have certain pharmaceutical products. And the people believe that they started using the medication assuming that they are something like a nutraceutical, like ghizai, dawai, ghizai, without any second opinion. As long as they are enjoying the benefit, they continue using the drugs. And the most important point is our formulation, the Unani formulation, whatever the pharmacopoeia you take, either it is a pharmacopoeia and non-pharmacopoeia, any textual, any reference book, you will get the formulations which are of multiple herbs are there. Sometimes it's a combination of minerals also there. Polyherbal drugs are there. And with one single combination, one formula is being indicated for multiple indications. If you look at that, and I have shown that Majune Chopchini, it is being used for Vajema, Fasil, Fa, Lij, Istarha, and many as a Musafi also. Of course, it is doing that action. And the purpose is if the patient with the different indication available on the drug started using for a long period, one cannot be imagined that how it is going to be react with your body, physiology, and the biochemistry. This is formulations of polyherbal with multiple indication. And if you look at our pharmacopoeias, I'm sure about that you people might be recalling from the textbooks. हमारी किताबों खराबादी में आप देखिएगा नुस्खे के इख्तिताम में उसकी खुराक बड़ी ambiguous लिखी होती है, मसला बन जाता है, लिखा होता है कि कहीं 5 से 10 ग्राम तक इस्तेमाल कीजिए, range is there. There is no certain description, absolute the concrete dosage concept are nearly not available. Very few formulations are there. Doses are ambiguous. How much should it take? It is 5 gram or 10 gram. When the prescription of the books, when the pharmacopoeia says the drug should be used 5 to 10 grams, what dose to be determined and how long it is to be determined. Coming to the another part is formulations without duration for use. For example, if you take Majune Dabidulwar, probably it has mentioned in most of the pharmacopoeia it can be given 7 grams, but how many times a day should be taken and how long it should be taken. Here, suppose if I believe the drug is not doing anything, I'm getting benefit physically, I'll continue as long as, but the thing is, but the modern conventional science has put some inhibition. Such a drug should not be used for a long time. One should be subjected to some biochemical parameters to be tested whether the drugs are not doing any delayed, what is called as the adverse effect. The point is, मैं इस बात को इस तरह करना चाहता हूँ कि हमारे बहुत सारे जो मुरक्कबात हैं किताबों में जो लिखी हुई हैं, though they are using, they are effective, but sometimes there is a discrepancy from one physician to the another physician. How long to be used, how frequently to be used. Is it 1 time a day, single time, or 2 times a day, 3 times a day, before meal and after meal. These are the very few factors what I thought it may leads to. जरूरी नहीं कि यही है, ऐसी चीजें बाज वक्त अफराद में मुख्तलिफ दिनों मुख्तलिफ तौर पे इस्तेमाल करने के लिए कई मिसयूज के बायस बनते हैं. ठीक, I have some pictures which I collected from this. This the first picture probably you can able to see. This is पे लिखा हुआ है एक मुरक्कब है जो इन दोनों बड़ा खूब गवर्नमेंट ऑफ इंडिया के कहने पे हमने कोविड के दौरान डिस्ट्रीब्यूट किया. उम्मीद कि आप सब लोगों ने देखा होगा. एक ऐसा मुरक्कब है जोफिकल ज़ोफ़े आसाब, खफकान और ज़ोफ़े दिमाग। अल्हम्दुलिल्लाह ये फार्मूला, ये जो फार्मुलेशन है आज़ा रईसा की तक़वियत के लिए ज़ोफ़ को दूर कर रहा है। खफकान मुमकिन है कि ये ज़ोफ़े कल्ब के नतीजे में अगर खफकान हो तो हो जाएगा, लेकिन अगर खफकान के असबाब अगर देखोगे मुख्तलिफ सबबें हैं, तो अतिब्बा ने सबब की बुनियाद पे इलाज का भी मुख्तलिफ बयान किया गया हुआ है। My concern here it is, see, this drug is, I hope that you people might be remembering, but this is a खमीर मरवारी। यहाँ इस पे कहीं भी ये नहीं लिखा हुआ कि इम्यूनिटी के लिए दिया जा सकता है। ये अतिब्बा ने तजवीज किया था कि अतिब्बा जो एक कमेटी जो तश्कील की गई थी, उन्होंने कोविड के दौरान बताया गया कि कुछ चंद जोशांदे दिए गए जिसमें उन्नाब से फिस्तान बेदाना रहा और टीनास्पोरा कार्डियोफिला गिलू की जैसे मुरक्कबात लोगों को इस्तेमाल करा गया। There is no such a period has been mentioned. People started using continuously as an outcry. You people might be knowing about that. Tinaspora cardifolia गिलू पे तो काफी इल्जाम दर इल्जाम चले जा रहा है कि कन्वेंशनल साइंस के लोगों ने कहा कि it has been caused hepatic toxicity। जब हम आयु सिस्टम के लोगों ने उसकी दिफा करने की कोशिश की, इस पे एक मोनोग्राफ भी आ चुका है। लेकिन शुरू करके सिया मैंने बराबर में तिरियाक नजली का भी लिखा हुआ है, ये लिखा है नजला जुकाम सुआल सुदा। दिस इज सम कोरिलेशन। अगर नजला जुकाम सुआल तो जाहिर बात है ये तो अपर रेस्पिरेटरी ट्रैक्ट इन्फेक्शन में होता है। अगर नजला मुजमिन बन जाए तो ये सुदा का बायस बन जाएगा। लाइक समवेयर इट कैन बी यूज्ड फॉर व्हाट इज कॉल्ड एज साइनसाइटिस के लिए इस्तेमाल किया जा सकता है। यहाँ मेरी मुराद है, ये तो कुछ मार्केटेड प्रोडक्ट्स हैं जिसके ऊपर लिखे हुए हैं, अनुश दारों पे लिखा हुआ जैसे ज़ोफ़े कल्ब, इरकान सुद्दी, इसहाल, जहीर। थेरेप्यूटिक इंडिकेशन इसहाल और जहीर ये दोनों बिल्कुल मुतजाद कैफियतें हैं। जवारिश पुदीना अगर आप किसी भी दवा का उठा के देखोगे तो कुछ मल्टीपल इंडिकेशंस हैं, कहीं तो मुतजाद इंडिकेशंस हैं, कहीं तो कुछ चीजें तसलसल से जुड़ी हुई हैं। But here that I mean to say is most of the dosage of 5 to 10 grams. If you look at this, जवारिश पुदीना के सिलसिले में लिखा कि 5 से 10 ग्राम। ये कहीं नहीं लिखा हुआ कि as directed by the physician. Again, things is left over to the physician. Why I'm talking about these things? Use of medication should be always as per the prescription of the physician, or it should be something like what is called as directed. If you look at this prescription, here we have certain ambiguity. 5 to 10 grams. What is the patient to be taken? If the product is not taken as a prescribed medication, over the counter अगर किसी ने ले लिया तो कितनी खुराक मिलेगा? 5 ग्राम या 10 ग्राम में? कितनी बार लेगा? दिन में 1 बार लेगा, 2 बार लेगा? खाने से पहले लेगा या खाने के बाद में लेगा? अक्सर दवाइयां ऐसी हैं जिसके साथ मुनासिब बदरखा भी होता है, इसका कोई तस्करा नहीं है। अब ये लेगा तो कितने दिन तक लेगा? So somewhere these drugs should be strictly monitored to be provided on prescription only. Here we have हब्दहुदार भी मुजब मफासिल निखर सिरकोने से, ये तो मुजब मफासिल के ज़िमन में लिखा हुआ है क्योंकि इसकी अजजा भी खुद दर्ज चारों के लिहाज इसकी खुराक भी 125 to 250 मिलीग्राम लिखा है। मान लीजिएगा अगर इस तरह की दवाइयां, क्योंकि इसके अंदर खुचला भी मौजूद है, ये मुदब्बर किया हुआ है, अगर मुदब्बर करने के बावजूद भी समटाइम वी कैन नॉट एक्सपेक्ट दैट इट मे नॉट बी कॉज एनी हार्मफुल इफेक्ट टू द पर्सन। If the patient started using 250 milligram tablet 3 times or 4 times a day, what will be the effect on the body if it is not being properly monitored? So concern is use of medication should be always promoted by prescription only. Minimize the counter drugs or something like ये जो चीज़ों का भी हमने बता दिया। मैं चंद आप लोगों से मैं कुछ चीजें और भी शेयर करना चाहता हूँ। ये मुख्तलिफ खराबादीन में हमने देखे, एक तो अरफ़ अंबर लिखा हुआ था, जैसे इसके मखफिया आम के लिए जनरल टॉनिक के तौर पर लिखा हुआ है, एंड नाउ हियर द डोज इज 60 ml। थेरेप्यूटिक यूज में ज़ोफ़े कल्ब बताया, ज़ोफ़े दिमाग है, ज़ोफ़े जिगर के लिए वाकई दिस इज वेरी गुड फॉर्मुलेशन, वन कैन बी रिकमेंडेड, बट 60 ml। द पॉइंट इज 60 ml, is it one dose, OD, BD, or how to be taken? And now unfortunately nothing has been mentioned about how long should be used. If the patient started using for a long time, we cannot expect that all the people will have the same beneficial effect. And now the drug is taken orally with Sharbat-e Anar. Sharbat-e Anar, Arke Ambar. Again, we are asking the patient to take combination of drug. I'll take you, if you ask the patient to take combination of drug, how the drugs are going to act into the body. Likewise, Arke Chirata, जो मुसफ़ी के तौर पे लिखा है, 125 ml twice a day. This is very wonderful. इस बात का हमें बड़ी खुशी हो रही है कि चंद दवाओं के मुताबिक लिखा है कि 125 ml 2 ले लिया जाए, बट मुद्दत का फिर इसमें निशान है कि कितने दिन तक दिया जाना चाहिए, राइट? अर्क़े उश्बा, ये तमाम बातें मैं हमारे सामाइन से इस तरह गुजारिश कर रहा हूँ कि when you ask the patient to, in consultation of the physician should be taken, because the physicians are the right people to decide any drug how long to be taken, how frequently to be taken. अगर इन बातों पे तवज्जो नहीं देंगे तो chances of the thing will become under the definition of abuse, misuse of medication, and those things will be reflected as in the form of drug related abnormalities. उशबा के सिलसिले में वही मामला 75 में लिखा है, लेकिन कितनी बार देनी चाहिए योमिया नहीं लिखा। अर्खेजीरा 75 ml because we use as a we have made the Caseria, and now almost most of the Unani physicians, they are prescribing Arkhezira and Safumohazil for this dyslipidemia and weight reduction therapy. And here it is not sure that twice a day this is okay, but to be taken or not taken as a thing that Habekibrit 250 to 500 milligrams. Again, how long should be taken? Of course, twice a day after meal. चंद चीजों के साथ लिखा हुआ है। अगर कोई बंदा दाफे किरमे अमा या कासिर रिया के तौर पे हब्बे किब्रित अगर इस्तेमाल कर रहा है तो उसके लिए बड़ी खुशी की बात है, लिखा है कि twice a day after meal. But the thing is again, how long to be taken? It's only happen with the prescription of the drug. हब्बे मुबारक बहुत ही मशहूर दवाई है जो बुखारों के लिए इस्तेमाल की जाती है, and this is the very worst condition is 1 to 2 gram, and this is a per day divided dose or 2 grams if it is thrice a day. So here, these are the things. If any patient who is taking the drug as a prescribed medication or over the counter should be very careful. Like this, हब्बे असगन के ताल्लुक भी हमारे जो खराबत में चंद चीजों में जो लिखा है 2 pills. Then again there is a insufficient inadequate information about that case को क्या किया जाए. 2 pills twice a day, thrice a day, with meal, without, before meal or after meal, and here lukewarm or archebadian at bedtime. Okay, at bedtime means only 2 tablets. Like if you look at there are different drugs which are herbo-mineral in combination. If people started consuming the prescribed drug for long time, I hope, because as I said, natural, of course हम पहले समझते थे कि फितरत से माखूज तमाम चीजें सेफ हुआ करती हैं, बट एक कॉन्सेप्ट साबित हो चुका है कि सेफ नहीं, ये भी एडवर्स ड्रग रिएक्शन बन सकती है। एक हब्बे शहम हंजल के मुताल्लिक भी एक नुस्खा हमने देखा। शहम हंजल तो ड्रास्टिक परगेशन में आता है, मुफत्तित सुदूद के तौर पे लिखा गया हुआ है, थेरेप्यूटिक तो खोलंजान सुद्दी जहीर, बट सी द डोज इज 3 to 5 grams। ऐसी सूरत में अगर फिजिशियन भी अगर कोई किस दवा को इस्तेमाल करना चाह रहा है तो कि 3 ग्राम में देगा या 5 ग्राम में देगा, पीडियाट्रिक डोज होगी तो क्या होगी, जीरियाट्रिक डोज होगी तो क्या होगी, कैसे कितनी क्वांटिटी में दिया जाए, कितनी किसी मुनासिब बदरगी के साथ दिया जाए। या हब्बे कुचला बिकॉज नक्सवामिका इज ए हाईली न्यूरोटॉक्सिक काइंड ऑफ ए थिंग, इसको 250 मिलीग्राम कहा गया। मान लीजिए 250 मिलीग्राम जैसे नजला बारिद मुजमिना लखवा फालिज नसे नजला में अगर देने की कोशिश करेंगे तो क्या ये खुराक एक वक्त होगी या 2 वक्त होगी तो कितने दिन तक देनी चाहिए, ये तमाम चीजें अतिब्बा की हज़ाकत पर मबनी है। लिहाजा प्रिस्क्राइब ड्रग पे ज्यादा इत्तेफाक किया जाए, और हमें भी इस बात को सोचना चाहिए कि दवाई को तजवीज़ करने से पहले कैसे किया जाए। यहाँ मैं जस्ट वांटेड टू ब्रिंग समथिंग लाइक दैट बिकॉज व्हेन वी आर आस्किंग द पेशेंट टू टेक सम ऑफ द ड्रग्स इन कॉम्बिनेशन और समटाइम द पेशेंट दे themselves taking the drugs, what happened, most of the drug if it's in combination it exerts some like an addictive effect. एक दवाई दूसरे दवाई से मिलकर सिंपली लाइक 1 + 1 = 2 का इफेक्ट होगा। मुमकिन है ये इससे फायदा भी हो जाएगा आपको। समटाइम व्हाट हैपन नाउ, सम ड्रग स्टार्टेड इफेक्ट विल बी मच स्ट्रॉन्गर, सिनर्जेटिक इफेक्ट। एक दवाई दूसरी दवाई के देने से उसके असर में बहुत ही ज्यादा तरक्की हो जाएगी, एंड दैट विल बी मोर इफेक्टिव आल्सो, बहुत ही स्ट्रॉन्ग हो जा सकता है। एंड दिस इज द थिंग व्हिच इज द फिजिशियन विल डिसाइड अबाउट दैट कि कौन सी दवाई को किसके साथ देना चाहिए, क्योंकि सिनर्जेटिक इफेक्ट होगा तो फिर उन दवाओं की क्वांटिटी को कम करके देना पड़ेगा, so that the drug effect should not cause any lethal effect on the body, and some potentiating effects are there। बाज दवाओं के साथ मिलाकर देने से उनके जो इफेक्ट में कंजंक्शन में इजाफा होता है या तो बिल्कुल खत्म हो जाता है। 0 + 2 जैसे जैसे हमने मैथमेटिकली समझाने की कोशिश की। एंटागोनिस्टिक इफेक्ट में मतलब ये हुआ, बाज दवाओं के साथ दो तो वो उसका मुज़िर के मुसले हो जाएगी और नतीजतन दवाओं के असरात मुरतब नहीं होंगे। ये तमाम चीजें अगर लाइल में से मरीज अगर प्रिस्क्रिप्शन ड्रग को कंटिन्यू करता रहेगा बगैर मशवरे के, या बाज़ वक़्त अतिब्बा ने भी इसी को इस्तेमाल करने की इजाजत दे दी लंबी मुद्दत तक, तो ये सारी चीजें इस तरह बदन के अंदर असरात मुरतब करेंगी। कमिंग टू द वेरी कंक्लूजन पार्ट, this is again issued by the WHO. As a physician, it is our responsibility before you give it to any medication, find out, know the drug, check the drug, ask about it. Yes, this is your medication. अगर हम किसी मरीज को दे रहे हैं तो हमारी जिम्मेदारी बनती है कि ये दवाई क्या वही मरीज के लिए है, and here we have to check about the right. जो दवाई हम तजवीज़ करें, is it the right patient to take the medication? Is it right medicine to prescribe the patient? इज इट राइट रूट? बिकॉज मैंने पिछली बार भी एक लेक्चर में बता दिया था, हमारे यहाँ शरबतें, नॉट ओनली मैं मेरे पास वर्किंग प्लेस में, बल्कि अक्सर हॉस्पिटलों में यूनानी के ही होता है, हमारे शरबतें और रोगनियात एक जैसे होते हैं, पैक में बंधे हुए होते हैं। अक्सर मरीज जो शरबत को खाने की जगह उसमें बेरूनी तौर पर इस्तेमाल कर लेते हैं, या ऐसा हुआ है, एक्सेप्शंस आर देयर, रोगन को उन्होंने पी लिया और शरबत को जिस्म पे लगा लिया था, द चांसेस आर देयर। इसी तरह जिमादात को खा लिया और खाने की दवा को जिस्म पे लगाया हुआ है। सो रूट ऑफ एडमिनिस्ट्रेशन शुड बी वेरी इंश्योर्ड, एक्सप्लेन अप्रोप्रिएटली, राइट डोज, व्हाट डोज शुड बी गिवन एंड राइट टाइम, whether to be with the meal, without any nectar should be given. Come on, ask your patient if they understand. This is very important part. This is the one which is going to safeguard the patient with reference to preventing the what is called the harmful effect of the drug. हमने जो दवाई दी है पेशेंट को, उनसे पूछिएगा कि क्या आपको बात समझ में आ गई, हमने जो दवाई लिखी हुई है, ऐसा ना हो कि एक्सटर्नल टॉपिकल एप्लीकेशन वाली दवाई ओरल हो जाए, ओरल दवाई टॉपिकल एप्लीकेशन पे हो जाए. This is the responsibility of the physician. Coming to the patient point, again the same thing, no check and ask. Patient before leaving, make them to be sensitized about that. Let them know their medication. Is it the medications for me? That you are using the right medication? क्या मैं सही दवाई ले रहा हूँ? अगर खुराक सही ले रहा हूँ, क्या मैं सही माने से इस्तेमाल कर रहा हूँ? Right time taking. And all these things should be inquired with your healthcare professional if you are unsure, if the patient is not sure. So with this presentation, I'm just trying to convince my people, fellow colleagues, please ensure with the patient and all the academician, the hospital staff to take care in all this aspect. No check can ask about this. Finally, the conclusion is what I believe this Unani system of medicine, I believe the belief about the effectiveness of system, it is continuous. अमूमन लोगों में ये देखा गया कि नहीं, यूनानी दवाएं, आयुर्वेदिक दवाएं, बिकॉज ये देसी दवाइयों पर मबनी है और इसमें कोई एडवर्स इफेक्ट नहीं होता, लिहाजा लोग मुस्तकिल तौर पे लंबी लंबी मुद्दत तक इस्तेमाल करते हैं. Continuous use can leads to ADR development also. And moreover, we believe that all natural drugs are not safe. As previously they used to think safe, अब ये नहीं है, not safe. लिहाजा one should be thoroughly check it. Prolonged use can leads to the manifestation of ADRs. लंबी लंबी मुद्दत तक, क्योंकि एडवर्स ड्रग रिएक्शन की रिपोर्टिंग में एक डिलेड रिएक्शन जो होते हैं, तो अमूमन बाज दवाएं जिस्म के अंदर जाके जमा हो जाती हैं, कई महीनों के बाद उसके मुतज़ाद असरात रूनुमा होते हैं एडवर्स ड्रग के लिए. मुमकिन है वो माइल्ड हो, मॉडरेट भी हो, सीवियर भी हो. जैसे जिस नौयत का होगा वो होगा, लॉन्ग इफेक्ट की बात होगा. More care should be given, are vigilant while on use of 4th degree drugs and pushtas. अतिब्बाओं को खासतौर पे जब मरीजों को जब दवाई तजवीज करते हैं या आपकी नजर से कोई गुजरे तो मरीजों को बिल्कुल चौकन्ना, एजुकेट कराइएगा. मरीजों से ये कहिएगा कि अगर कोई ऐसी दवा जो दर्ज चाहरुम किसी भी मिजाज की हो या ऐसे कुश्ता जात जो इस्तेमाल कर रहे हो तो उनको आगाह कर दीजिएगा कि ज्यादा दिन तक इस्तेमाल नहीं करना चाहिए. और कर भी रहे हैं किसी गर्ज से, जरूरी बनता है कि असेसमेंट ऑफ बायोकेमिकल पैरामीटर्स आफ्टर सर्टेन पीरियड. मॉडर्न गाइडलाइंस यही कहते हैं कि किसी भी मरीज को देसी दवाइयां जिसमें यूनानी हो, आईएसक्यू भी हो, अगर दे रहे हो तो 3 महीने में एक बार, कम से कम 4 महीने में एक बार उनकी ब्लड पिक्चर देखा जाए, so that we can able to see any organ related impairment is not going to be. Sometimes what happen, it can cause hepatotoxicity or renal toxicity also. And try to control this medicine without prescription and without advice of healthcare professional is avoided. इस बात को तरजीह दें कि मरीजों को इस बात को आगाह कराएं कि मुमकिन हद तक दवाई का इस्तेमाल हेल्थ केयर प्रोफेशनल की एडवाइस पे लें. अगर आपके पास पर्चा हो आपको फायदा भी होगा, बट इट शुड नॉट बी कंटिन्यूड फॉर एवर. एनी अनइंटेंडेड इफेक्ट मस्ट बी डॉक्यूमेंटेड. मेरी तमाम तिब्बी बरादरी से सब लोगों से गुजारिश है कि अगर आपको कभी किसी दवा का इस्तेमाल के बाद कोई ऐसी चीज जो गैर मुतवक्का अनइंटेंडेड इफेक्ट अगर आपकी नजर में आ रहा है, मरीज ने कहा, तो प्लीज डॉक्यूमेंट इट, report it accordingly. Otherwise, no, you are going to help the project and we are going to make our science more safety. Thank you very much for being with me.